and she feels fantastic. So
I don't know why. We'll talk. Let me know when we're on.
okay, I think we're on now.
Okay.
Yeah,
Well,
streaming on YouTube.
let me talk about this. First of all, I don't know. Dave Lee gave a presentation on your YouTube channel that was absolutely, actually, I saw was very educating, amazing, actually. So, and I would never ever say anything unless it's face to face. So I'm waiting for Dave so we can give a talk together. Now, I'm not an expert on pregnenolone because I really don't use it that much in my practice. Keith Nichols is the expert. I'm not an expert on pregnenolone. I had not used it that much because many years ago, Danny, many years ago, I was seeing patients from England, okay, and they were coming to see me, and these people were on pregnenolone, and they were being put on pregnenolone because it was not a prescribed medication; it was over the counter. So you can go buy it, and it's still you can buy it over the counter. I don't know if you know that in the United States.
Mhm.
And so I started seeing what they were doing, and I saw prescriptions of 10, 15, 20 milligrams, and then I saw somebody on 400 milligrams, and they start seeing people on 400 milligrams. The only problem is that I never saw the response or the uh, clinical outcome that I like to see. Now, do I use it in my practice? I do rarely. I have to have certain circumstances in which I'm going to use it, and if I use it, I'm going to use it for traumatic brain injuries, something like that. But otherwise, I don't use it that much because I can use cholesterol then as the parent of all the 50% of all the hormones. And I know that the limiting rate is the cholesterol to pregnenolone conversion. So, what do I want to use it? It goes to progesterone. It also goes to DHEA. Those are the two outcomes of pregnenolone. So why not do that from the beginning? Nothing against Dave. I don't really use it. Not because I don't want to use it. I prefer to use the direct approach, I guess. Now, my decisions clinically to use hormones, they had never ever come from blood tests. I don't want people to say that, oh, Serrano gave me this because my blood test. I can never do that. For me to make a decision to give you any hormones, yes, the blood tests have to show it, but I have to see what are you doing. Think about this. Neil always tells me that testosterone doesn't cause heart disease. I agree with Neil. Testosterone doesn't cause heart disease. Can I give you a heart attack? And Neil disagree with me, but I agree. Yes, he can. And let me tell you why. Here comes a 45-year-old guy. He's a lazy ass, doesn't do nothing, eats fat, sits down at home. Okay, and his testosterone at 100. And I put this guy on testosterone. Now he feels like Superman. Now I'm going to go exercise. Now I'm going to do all this that he never did. I'm going to go, oh, I can get it up now. So here's a goal that guys that was not doing anything, so the heart doesn't have to work. Now the guy is doing high intensity workout. What happened? He dropped of a heart attack. Did
Right.
the testosterone give it to him? Absolutely not. So I have to agree with Neil. Actually, the testosterone helped him. But the problem was that it was too late. So for me, I have to find out what they're doing, where they come from, how they're eating, what are they sleeping at night. I got to do all that before I make a decision. Now,
There was Eric. Very quick. There was you probably heard of the guy, the anabolic doc. I think it's Thomas O'Connor. He's got a YouTube channel and he discusses a bunch of stuff. Apparently, there was a study that came out recently where he said they're finding a more frequent occurrence of heart attack or cardiovascular events or whatever on guys on TRT. But generally speaking, the men are living longer. And it just goes to what you're saying is they're, I'm on TRT, everything's great. They have all this energy, and then boom, their bodies are just not prepared for the load and they drop. But
okay, the best way to explain this, Danny, this is easy. I don't know shit about cars, okay? But think about I have a Rolls Royce Spark on my house, right? And I change the tires. I have the best boom boom radio on it. I put an iPad machine on front, with the best of the best. And I change the spark plugs, and I change the oil, and I change, I put and testosterone in the oil. I change the oil, blah, blah, but then I put water on my gas tank. I don't care what kind of car you have, it's not gonna work. You might work, the engine might work better when you put the right nutrients on it, but it's not going to work. And I try to explain to people that, for me, if I have a guy that is 50 and older, I usually will go through an EKG. I will even do a calcium score to see where they are. And then I say, okay, you're safe. I know that is defensive medicine, but in the United States, you have to practice that way. And I like to see, if you're very obese, for example, this is the perfect case. I saw a 52-year-old guy, looks much older than I do, in my office, right? He wants testosterone. His testosterone is 202 with a free level of only 4, right? And I'm like, well, I'm going through everything, but then I listen to his heart and the heart is beat really fast, sinus tachycardia. So I said, let me do this. So I do this and I go, whoa, hold on a second. Your EKG looks like you have maybe an all import. And this guy is only 52. Then he tells me, well, I never had chest pain. And I go, let me check your sugars. And I don't do a blood sugar test to identify diabetes because you can identify diabetes. And I want to teach this to other doctors. If you are 45 and older and you have wrinkles behind your neck, you have sugar issues. If you have a skin tax, you have sugar issues. And if you look at your bicep and you have a line on the middle of your bicep, you have diabetes. If you look at the dorsum of your wrist and you have wrinkles, you have sugar issues. I'm 57, I don't have any. So that's because the sugars are going up and down, up and down. They damage your collagen, which is the most abundant protein in the body. And that will teach you there, hey, I'm having issues. Now, this guy wanted testosterone. I said, oh, crap, I cannot give you testosterone. Even if the testosterone can actually expand or extend his life, I'm doing him no justice because he's going to go exercise. I'm going to feel better. When I check his sugar, they were 324. He didn't even know that. So here's a guy that is diabetic, unknown to him. So I say, I cannot give you testosterone. I got to get you examined. I got to make sure you're okay. Iodine calcium score hasn't come back, so I'm waiting on all that. I even consulted cardiology just because he had a whole heart attack, and I said, we need to find out how much damage you have. Should I give that guy testosterone? I will do it later after he gets evaluated, but right now I can't. So people have to be aware of all those distinctions.
But the thing is, Eric, is that like you're saying, a guy's a lazy ass, whatever. He gets testosterone, like, oh, I'm starting to feel a bit better. Great, now I'm going to start exercising. But there's also the guys that aren't taking testosterone. They're lazy ass too. They haven't done anything. And they're like, you know what? I need to change. This can't go on. And they said, I'm going to get up and I know I don't have the energy and I know my testosterone levels are crashed and I know everything is crap, but I got to start somewhere. They start exercising. They'll be just as likely to potentially drop of a heart attack if they're doing too much too soon.
Oh, absolutely.
Right?
I have to agree with you. So, it's just that, but you know what? The media never looks at that way. The media is going to only look, oh, you added testosterone. That's the reason why he had the heart attack, which is never was.
It just motivated him, really. It gave him some motivation. I have some jet fuel in the system. Let me make the most of it and let me go. Go do some more. But even if he didn't have the jet fuel, he could have just made the decision, I'm going to do what I can with what I have. The outcome probably would have been the same.
Absolutely. It's kind of funny. The last time I checked my testosterone levels was for, I was going to get for my life insurance for my kids. And I say, oh, I had testosterone. And it was 254, which is extremely low. But of course, I remember during that time, I was working on the freaking, in the unit, and I was going up at night and I was doing all that stuff. And, lately, like, I don't have the motivation to go and work out like I used to do. I tore my meniscus and my ACL about 5 weeks ago. I'm back, but I don't have that. But, I train dogs. I used to train dogs for the police and I used to compete. And I just got a new puppy. And here you see me training every day now because I got the puppy, because I want the puppy to attack people, and I enjoy that. So I'm going at it full go. And my wife was like, oh, you're getting up at 5 because you want to, I can track with the dog in the morning. So maybe not to work out, but I'm doing other things. Do I need testosterone? Yes, I do it. Do I use it yet? No, not yet. I don't see, eating makes a huge difference. I don't see that plummeting effect. Now I want to tell the guys out there, I do need to use a fishing pole once in a while, slowly to get it up, but it works, and at 57, you should be having issues. I don't think that is true, because when I'm exercising, eating correctly, I have no issues. If I'm sleeping okay, I have no issues. Now, of course, the stress factors get on the way, and you do know a lot about stress, don't you, when you have children, Danny, and that is crazy. So, like right now, we're supposed to be here at 2:00. Well, my daughter said, oh, I got to move. Well, shit. I got to go pick up your boyfriend out there for here is changing speed to do something that I wasn't planning to do, which stress, I think, is the biggest or most, stress and nutrition are the two most influential factors in your health. And well, no, I need to add one more thing there. Even faith or spirituality. People don't look at that, but let me tell you one cool study. They took 844 patients, HIV patients. I think there were more. I don't remember how many, but they were at the same clinical stage, meaning same white blood cell count, same pneumonias, same infections, everything, and they put on the same amount of medications. They were absolutely blood-wise, they were identical. 50% went on and lived their life. The other 50% have the same life, but then there was one difference, okay? In 150%, they have four nuns, Danny, praying in one room. These people didn't know they're going to be prayed for. They just said, we're going to pray for these people. The nuns were provided with pictures only. They didn't know anything about these people, right? And the other people, nothing, even though they were taking the same care. Well, at the end of 3 years, I think it was 3 years or 6 years, the people that were not being prayed for, only 17% were still alive. The people that were praying for, there were 78% still alive. Is that, that tells you something. I mean, what is it? Was it coincidence? No, because they were just separated based on blood tests, based on conditions. So that is crazy. And I've seen it myself. I used to say, woman, I have the secret for women, and I would tell women in my office, all you need to do is the 2F, right? And one is the food, and the other one, you know what it is, right? But then I said, whoa, I'm older now. I used to teach that at 28. Now you have friendship, you have flexibility. And guys, I'm not talking about flexibility opening her legs. I'm talking about if you want to go fishing, and your wife hates fishing, she goes fishing with you. You see what I'm saying? That's the flexibility. And then I added faith. Faith brings respect and all the other things. But it's crazy how much you learn as you get older. You go, whoa, I didn't know that. So that's why. It's crazy.
I got you.
Now, I want to talk a little bit about DHEA.
Yes.
First of all, I don't want people to extrapolate between mice, rats, and humans. And I know we say that over and over. Dr. Nico said, I said, Neil said, Neil says the same thing, but I want to give you data of why I want to tell you this. When I was reading a lot about DHEA, because for a while DHEA supposedly didn't do anything, right? Oh, don't worry about it, doesn't do anything, because it's over the counter, and it's over the counter, it doesn't do anything, which I'm going to explain why in a second. I said, okay, I'm going to read a lot about DHEA. I'm going to find out what DHEA does. And of course, I look at rat studies and mice studies. The only problem is that the mice, rats, adrenal glands absolutely do not work like humans. I want to put that out. There are similarities in physiology, absolutely. But there's more insimilarities or no similarities at all between, I just made that word up, by the way, between rats and humans. So be aware also, rats and mice in real life, not in the lab, not in the little cage, are opportunistic feeders. And I will explain what that is. Rats will eat when they can. So how much stress do you think have the rats to survive? They are always stressed. They have to eat at night. They have to hide to eat, all those things. Now, the rats and mice in the freaking lab, they're fed. They have no stress, but they want the guy coming to feed them, which completely changes the physiology of the system. Okay, now also the rats and mice in the lab are also bred for specific gene conformation or gene defects or SNPs or whatever. So we need to be very, very careful when we take a study from rats and mice and pass it on to humans. I just want to add that. Now, the DHEA works amazing. Now, why it doesn't work? In 2002, I went and bought about 10 DHEAs on the market. I went picked up 10 DHEAs. I want to analyze them. That's when I was crazy and I was paying to analyze all kind of stuff. And I paid for it. Actually, it cost me $4,000. And out of the 11, only one had the DHEA what it says he has. Okay, which is crazy. I have done that with fish oils too, and that'd be another talk. But there was only one had the DHEA, and it was 25 milligrams, and only had 8.5 milligrams in one of the capsules. So he said, are you taking real DHEA or are you taking DHEA that is not there? Of course, I only analyzed for DHEA. Who knows what it was in there? I was paying for it. So I said, no, just find out what it is. Maybe they have B vitamins. Maybe they have all kind of stuff on it. But I was looking for the DHEA. So that brings me to one point. If you're going to use DHEA, don't go buy it over the counter. Make sure that you have a good company that makes decent, you have to know that company. Great companies are Claire or what are they called now? Claire Labs. There's also Pure Encapsulation makes a good one. Douglas Labs makes a good one too. And those are owned by Nestle, by the way. Claire Labs are not, but they're owned by Nestle. So the quality of those are decent. I mean, there are other companies. Let me see. Zymogen has a good DHEA. So this all other companies are actually more occurred to doctors because they want to make sure that they put what they're supposed to put in there. So I have stay away from that. Now, do I use DHEA in my office extensively? Now, funny thing is DHEA is a whole bottle of wax because it depends what you're using it for, who is using it, okay, age, levels, and why, and route, by the way. Now, let me give you an example. For better erections, sublingual DHEA works better, believe it or not. How do I know? Because patients teach you everything. You know, there's no research out there that tells me, oh, when I take sublingual DHEA, I get a better heart. No, I have a patient that he doesn't want to swallow capsules or pills. So I said, you know what, I'm going to compound it for you. Who give a shit? So I give it to him. This guy shows up 2 weeks later. Oh my God, I had the best erections in my life. And I said, oh, that's placebo. Don't worry about it. Of course, you know, I'm a physician. That's placebo. You know, you think you're taking something. But then I said, well, let me try it with 5 more people. Where all of a sudden, shit, Serrano, high five. This is awesome. Well, DHEA sublingual works awesome for erections. How and why? Don't ask me. There's no literature on well, there's one paper using sublingual DHEA. They don't talk about erections though. Okay, now is DHEA?
Is it just getting better absorbed, maybe compared to oral?
I don't want to well, let me speculate, but this is no research. I don't want to go tell people there, oh, the research shows that. There's only one paper. I do have it, but I think it's no better absorbed. I think it just give you higher levels very quicker and bypasses the liver because it gets on the submucosa and gets absorbed. I might go directly. Are there DHEA receptors in the penis? Who knows? Like Dave said, we do not know. There's no receptor for DHEA. Although I don't agree with Dave there. I think we just haven't found them. But there are DHEA receptors. I don't know if they are or not, Dave. So I'm going to say, yes, I got to give you kudos there because they haven't found one. Now, why does it work better? I do not know. Now, let's go to another point, DHEA skin. Some people use DHEA. I have not seen the levels that I want to see with DHEA dermal. Now,
transdermal.
Yeah. So, you know, they say, oh, it's because you use it first, meaning I apply on the skin, go through the blood, and I use it first. Well, you know, where did it go? I mean, were you that empty that it disappeared? I can see one of the first 2 applications where you have been using it for a while, then, you know, those receptors are going to get overloaded. So there should be some DHEA out there. I haven't seen the levels that I want to. With progesterone transdermal, I have not seen the levels, but I do see a responding anxiety with transdermal. But I have not seen the levels. Some people say, oh, you don't see the levels. Well, you know, why do I see the levels on other ones? You know, don't give me that crap. Is it hiding? Where is it hiding? Is the liver holding it? No, the liver doesn't do that. The liver either metabolizes, sulfate it, or whatever. So, you know, I have to be sure what I'm doing. Now, Dave, I want to say this. Do I use it orally? Absolutely. Do I use it sublingual? Absolutely. Do I use it transdermal? No. I have not seen the result transdermal that I see. Dosages, it depends. Average woman, 10 to 15 milligrams. Man, I can go 25, 50. It depends. Now, why it depends? Because if I have somebody that is highly stressed, that their parents die, they're moving, losing a job, that people are higher production of cortisol, I got to give them DHEA. Now, I want to make clear so some people understand. People do not know this. Most people think that progesterone comes from the ovaries. Most people think progesterone comes from the testicles. That is wrong. Progesterone comes from the adrenal glands. I want you to learn this, Danny. If a woman makes progesterone from the ovaries, because the corpus luteum is working. And the corpus luteum is in the second part of the cycle, okay? And that's what makes progesterone. After the corpus luteum is the most powerful progesterone maker than any other part of the body. He makes more progesterone than anything, okay? But then it goes away. So people think, oh, progesterone. No, progesterone is a great marker for function of the adrenal glands, okay? It does come from the adrenal glands. And the postmenopausal, 100% comes from the adrenal glands, which people don't know that and I say I owe you a paper, I'm going to send it to you. So be aware of that. So I know the progesterone is not for the cycle, but we tend to cycle it because corpus lutein again produces, the ovarian produces this, or the ovaries produce this, and that's when they're high level. It's because the corpus lutein is adding to the adrenal output. Okay, let me repeat that. Corpus lutein is adding to the adrenal output, so now the levels are extremely high because the corpus lutein produces that. Now, if the corpus lutein is gone, progesterone is produced actually by what your adrenal glands output is. Okay, now if you're highly stressed, progesterone is not going to stay there for you. Oh, progesterone Christmas. No, progesterone has to go somewhere. You have to go to hormones. You have to go to estrogen. You have to go to testosterone. You have to go to cortisol. You have to go to aldosterone. So let me give you an example right now, Danny. Okay, here I am. I see a guy in my office or a woman, and she has high blood pressure, right? Why are you having high blood pressure? Well, you know, I'm having fight with my husband and my kids, blah, blah, blah. Well, the progesterone is being used to make what, Danny? Aldosterone. Because they're highly stressed. You have to go into that little, they've had it on the left side, I think. And you have to go to aldosterone, which has to be produced to increase your blood pressure to keep you be able to get up, to do movement, all those things. So be aware of all those little things. Do not go to your doctor and say, check my testosterone is the only thing that I have run, or check my progesterone is the only thing I have run. No, you need a freaking clinical assessment. You need to know what is going on with that patient. That's what bothers me sometimes about people when they're not physicians. Oh, I got the levels, and a lot of experts in the internet. Oh, I got the levels, so I'm going to give you this. That's what I don't do. Internet, I have to see you face to face. No, I have to sit there. I got to read you. You know, I can read a patient. I can sometimes predict in which side you sleep by looking at you. I can tell you which side you snore because you're going to go to one side or the other side. Allergies play a component in there. I got to check your tibia. I smell your feet in my practice. You can ask my patients. You can call any of my patients. The doctors are going to smell my feet, and they're going to go, and I went there, shit, and this guy take the shoes off, my socks off, and smell them. And then he put the shoes back on. And I go, what the hell is this guy doing? And then, you know, I sit back and I say, take your shoes off. And the patient, well, you just took them off, look at them, touch them, smell them. Why do you want me to take my shoes off? Well, Danny, if you have back pain, how do you take your shoes off?
If I have back pain,
yes,
I'm going to take them off. I'll take them off sitting down.
Thank you, sir. Thank you, sir. So there is a clinical finding. I want to see how you take your shoes off. And then I say, oh, your hips are tight. Well, what? How do you know? You have back pain on the other side because you took your shoe, the right shoe one way, and the left shoe, you push it off. You couldn't bend over. All those little details tell me clinically, give me a picture of what's going on. You see what I'm saying? Even though you're not there for pain, you're there because my testosterone levels are low, but I see you taking your shoe off. Clue. Okay. Now, why do I smell the feet? Because sometimes you cannot see yeast infections, but you can smell them. They smell like vinegar. If you smell Angie's a clean lady. Angie, I hope you're listening to me. Angie, if you go smell
Angie's very dirty. She's very dirty.
Angie, you know, smell the feet of your wife and go toe by toe. And if she have almost smells like vinegar, like an acidic smell to it, that person have yeast. Now, why do I smell feet or feet, men's feet? People go, you're not.
Foot fetish?
Yeah, I have a foot fetish. No, I don't. But you know, sometimes women come to my office and I keep getting a yeast infection. I keep getting a yeast infection. I go, why? You know, why? And then the husband comes with them. I tell the husband, take your shoes off. They have yeast all over their feet, right? What happens when you put your underwear? You rub that skin, you rub those toes, and you bring the yeast to your testicles, to your penis. Okay, you see what I'm saying? You're not aware of that, Danny, but I am aware of that. And it's kind of funny because girls put their underwear very, very carefully. They don't touch nothing, right? But guys, they put the underwear and they touch everything. Who cares, you know? So all those little details that I see, I have to be aware of them before I do make a clinical decision on anything. Are blood tests important? Yes, but it's like a puzzle. That's one piece of the puzzle. There's too many pieces for me to give you one detail of anything. I look at genetics. I look at 23andMe. I look at DNA toxicity. I look at all those things. I look at toxins. I look at all kind of stuff. You know, one guy that you need to have here is a guy named Dr. Brian Walsh. The dude is a machine. He's a naturopathic doctor. I hate naturopathic doctors, but I got to give Brian kudos there. Brian has a course called the Metabolic Fitness. And for anybody that doesn't know shit about nutrition, doesn't know anything about lab testing, doesn't know anything about blood testing. This is one of the best courses I ever seen. Even I'm an MD, he taught me so many things. And Brian is a good friend of mine. I know selling anything. Just look metabolicfitness.com and I can text you Brian cell phone or whatever, so you can interview him because you're very surprised on what he can tell you about testing and detoxification and all those things that he knows. And it's just amazing what you can see on a patient, you know, when they just walk in, Danny. Like, for example, when you smile, do you smile to the right? Do you smile to the left? Well, that can tell me what happened to your teeth. Your tongue can tell me are you B vitamin deficiency? You have issue with your gut. All these things that you can see face to face that you cannot see on a phone or a one quote interview without seeing you. So that's why I'm so strict. And like I said, you and I were discussing, I was saying, oh, I'm going to take phone calls, but I was charging $500 for half an hour. Here I got 63 people in 24 hours that want to talk to me. I go, oh shit, forget this. I don't want to do this. I prefer you to pay me for me seeing you, discussing labs, you know, all those things. That's why I do it.
And get your money's worth. Yeah. So all you guys and girls have been messaging me nonstop. How do I get in touch with Eric? And I'm in England, and I'm in Australia, and I'm in Japan, and I'm in Hawaii. I want to deal with Eric. You heard it from the horse's mouth. He needs to see you. He's like Dr. House on TV, but he actually cares about people.
You know what? I can make more money, Danny, doing phone calls than doing in my office. Absolutely. But it's not worth it. I like to see the patient face to face. Like I said, I have patients from England. I got patients from Japan. What's my farthest patient that I have?
But they fly in to see you.
Yes, I have patients from, Argentina. I got 4 patients from Argentina. They're awesome.
Or they're wealthy and they'll fly you in to see them.
I have done that. The only time I do that is they pay for my wife, you know, and we go there and spend time with them and stuff like that. I have a psychiatrist that right now, she lives in Seattle. She's awesome. Awesome. This lady I met, I seen 17 years ago when they thought her husband was going to die. You know, I saw him. I fixed him. He got better. The husband is 50 years older than she is, Danny.
50?
50 years old.
Holy shit. Is he on TRT?
He was, and later, you know, he passed away though. He actually passed away about 2 years ago. And I haven't heard from her because she's from Seattle and she's a physician. She finally called me and said, Eric, I need to come and see you. I'm getting old. I said, shit, how old are you now? 62, 60, or 65. I said, come over. And she's amazing. Her knowledge is incredible. You know, when you want help from a true psychiatrist that knows functional medicine, that knows, you know, real medicine, this is the lady. And she's amazing. And, you know, that's another lady that knows a lot about everything. But in my career, I have met, you know, people like Dave. They teach me. I learn from my patients because they show me what I'm doing wrong. For example, the lowest glucose. This is amazing here. The lowest glucose I ever seen on a patient until recent was 22, right? So I said, whoa, that's a lab error. I called them. No, it's 22. No hemolysis, nothing. And just Friday, I got a glucose of 8. No hemolysis, no nothing. I think it's wrong. I told the lab, you guys got to recheck this. And this is LabCorp. So I'm not doing no lab. So I said, nah, way. So I'm waiting for Monday to see what they tell me. But I want to know there was no hemolysis or nothing. Something happened to a specimen because there's no way it can be 8. But we'll see. I keep you informed. One thing I also want to add, I got a picture, Danny, of a person that's in TRT, in this case, shots, right? And some people use tests, urine tests, or blood tests. Blood tests are still the grandfather, the father, the son, everything. Blood tests still the machine. How do I know? Because I used to measure saliva, and they'll be perfect. Like, you know, you have those little curve right on the middle. And I go in that room like a rooster, you know, with a big chest out. And I say, how do you feel? And I feel like shit. I mean, wait. What do you mean you feel like shit? I feel like shit. I said, well, look at the test. Look at this test, how pretty it is. I say, Eric, I don't give a shit about the test. I'm telling you, I feel like shit. And here we are. I said, okay, I'm going to do this. So I took 100 people. And I did saliva test and I did blood test. Never, ever was the saliva accurate compared to symptoms. The blood was always accurate. Urine, it is accurate in specific scenes at specific times. If you're taking shots of cypionate and you get a urine test, be aware that your testosterone might show low, but it's not low. So just want to make that comment. Now,
which specific test for blood tests are you ordering a specific test or just general total T, general direct free T?
Core Quest Labs, whatever. I have people that use urine tests that come to see me, like Dutch test. I don't know if you heard of the Dutch test. You know what that is? Dry urine total comprehensive hormone. It's excellent test, by the way. I highly recommend it too. But I just want to say, by the time they come and see me, they have done so many tests. They have done oats. They have done all kind of, genetic tests. So it's pretty cool. So yes, I like to see all of that. I am like a computer. Give me information, then I can give you information back. So that's how it works. But right now, I got to answer your question on DHEA. You asked me about dosages. I got to finish that. What is the highest dosage I ever seen in my office? 1,000 milligrams. No, I did not prescribe it. No. Hold it. You asked me, I got to answer your question. It was 1,000 milligrams. The patient was doing fantastic. 84 years old. I feel great.
1,000 milligrams a day?
A day.
Oral. Tablets.
Oral. What was his level? It was 1,444, I think. It was something, it was pretty high. He's still alive. So, and he's doing amazing. Now, was I giving him those dosages? No, it wasn't me. I mean, he feels great. And he's not taking anything else.
Because most tablets come in like 25 milligram tablets, right? So he's taking like 40 tablets, 40 tablets a day.
You can compound it.
Okay.
He was being compounded by somebody. You know what? I take it back. He was taking sustained release with 1,000 milligrams of sustained release. And he was doing, his DHEA was 1,044. His testosterone was 894 at 82 years old.
Holy shit. Just from the DHEA.
Well, something, I'm supposed to say, no. But, what else was happening? I mean, he's not taking anything. He was treating himself with red light. I don't know if you know what that is. It's called Jovi. Red light. Have you ever heard that? Red light?
Red light therapy?
Yeah. And
yes.
And he was using it and he would sit in front of it for 1 hour a day. And he said, that makes a difference too. So he's doing good. He's healthy as hell. I'm not going to argue with him. He feels great. What can I do? I just follow him, just come here every 6 months and I check him. Amazing. And he runs marathons now. And he never did that. So can't say a word. Now the literature has the highest dose I think is 1,200 milligrams or 1,600 milligrams, I think, was the highest dose. And I see what done for 12 months. And the people did fantastic, but they didn't keep going. They just stopped at 12 months. So what's the highest dose? I do not know. It's the most abundant hormone in your body. For what reason? Danny, is more abundant than testosterone, more abundant than estrogen. Why is it so abundant? Something is going on. Now, I know that.
Meanwhile, it's illegal in Canada, where I'm from.
That's why. Yeah.
It's illegal. It's the most abundant hormone in our body. Illegal. It's bad for you. Well,
wait a second. Can you prescribe it or not?
I don't even think you can prescribe it. I'd have to check, but I don't even think you can prescribe it. But you definitely cannot buy it over the counter.
Wow. How about Steven? Does he prescribe DHEA or not?
I'm not sure. I'm able to get it through Amazon, through some vendors that either they don't know the law and they're shipping it to me anyway, or they do and they're like, we'll ship it to them anyway. But I'll find one and I'll buy 12 jugs worth of it and last me for 2 years. But
I cannot believe it. Are you serious?
Yeah.
Why? Is it because it's considered anabolic steroid or what?
I don't know. Apparently, it can cause harm. It causes this problem, that problem. It'll cause sex issues, heart attack, stroke, all of this. Meanwhile, you could buy cigarettes. You can buy booze. They legalized marijuana. So you got these drunk guys walking around in the streets smoking weed. Well, I want to take some DHEA for health. No, illegal. It drives me nuts, man. It drives me nuts.
Funny you said that. I use a lot. You know what? I use a lot of DHEA for infertility in women. Tons.
What increases sex drive like crazy in women?
No, not that. No, it helps the ovary repair. Let me repeat that. DHEA 10 milligrams on people that cannot get pregnant. The DHEA will allow fertility on those patients. I have the research, Danny. In infertility, and a woman has unable to get pregnant absolutely measure the DHEA, even if they're low normal, treat them. Allows the ovary to work better and allows them to ovulate. It is crazy. So I think that DHEA helps in ovulation. And let me explain to you why. This is a Serrano hypothesis. Don't go out there as Serrano said this. This is a hypothesis. Okay. What happens when a woman is really highly stressed, Danny? First of all, do they want to have sex?
Nope.
No. Because what's happening? The pregnenolone is not going to testosterone, it's going to cortisol because I'm highly stressed.
Right.
So their hormones are changing. Stress changes your periods, stress changes everything, the way you act and everything. Number two, here is a woman that wants to get pregnant, can get pregnant, and a woman that cannot get pregnant feels like she is below. Or I cannot get pregnant, I fail my husband, I'm not a woman because I cannot get pregnant. So those women get more stressed mentally and physically. So I look into the literature and say, okay, and I did it by accident. I give DHEA. This woman got pregnant. So, whoa, what happened? When I look in the literature, DHEA repairs the ovaries. I'll send you the paper. It's awesome. Now, it works also in some people with PCOS. I might give you a low dose, 2.5 milligrams of DHEA, and it helps them get pregnant. Now, there are some people that with DHEA, they develop acne. Don't go out there and say, oh, I don't have no side effect. Yes, there are women that develop acne with DHEA. Now, do you have to back off? Absolutely, back off or change the route because it will work different. So you say, hey, I want to give you DHEA. Well, why are you doing it? Find out the reason why you're doing it. So you have to be aware of all those changes. So,
because especially with the PCOS women, they'll tend to have more acne because they're higher tests. So they're taking DHEA can make it worse.
Absolutely, but for a woman that has PCOS, it's also harder to get pregnant. You see what I'm saying? So all those little intricates that make it part of it. That's why when you make a decision, don't only make it on blood levels, make it on the patient history, make it on the patient what they're doing and everything.
So would you only give DHEA to women under 40 if they're having issues getting pregnant? Because I heard that under 40 for women is not recommended.
Okay. I do not go by recommendations all the time because if I go by recommendations, I shouldn't give you testosterone. You're too young. Why are you needing testosterone? I go with what the clinical presentation is. I have women that are 30s, yes, that I do have on DHEA. Why? They were physically, okay, let me give you a case right now, Danny. So I want you people to understand why medicine cannot be a freaking cookbook. It pisses me off. I have a 31-year-old woman that presented to my office, low sex drive, right? Don't feel good. Joint pains, food allergies, all that stuff, right? Doesn't tell me, I ask personal question, I'm great, right? The way the fat is deposited on your body can tell me you're being physically or verbally abused. They're going to say this is bullshit, I'm crazy, but you can actually tell. And you know what, Danny, remind me and I'll send you pictures of patients and you're going to find out how. And this woman has certain fat patterns. I said, this is not right. On her third visit, I said, okay, something is not right. You're not telling me. I don't want to treat you. She freaked out. So I feel better. Why you don't want to treat me? I said, something is going on. You're not telling me why. And I said, I'm going to check your DHEA levels. I haven't checked them. Yeah, I'm going to check your DHEA levels. Why are you going to do that? I just hear from she was only there for the thyroid, right? So I got to check them. I don't know what's going on. So I went ahead and did that. When I did that, the DHEA levels were, I think they were 51, okay? Which is extremely low by any means. And I go, well, I'm being abused. By whom? Well, I am being abused by my husband, but I have a lover. So, here are massive changes that were not being able to be seen, but they're seen based on the findings. So I put that lady on DHEA. What happens? She feels better. She can handle the stress better, okay? So I cannot tell you I would never do that. No, it's bullshit. Don't believe that. It depends on each case. Now, which is the hormone that the baby makes? Which hormone the baby makes? Danny, I taught you this. DHEA. No.
Oh, yeah.
Remember, we discussed
Yes. At the beginning.
Yes.
When they're first born for up to 6 months or something.
Absolutely, but people don't know that. Why a baby makes DHEA? Because he has to go to a freaking canal. It's stressful as hell coming from that little hole, and then you have to breastfeed the sucker and he doesn't sleep. So he might need DHEA because he's highly stressed, Of course, that's a hypothesis, but no, the baby makes DHEA because the DHEA goes into estrogen or testosterone, whatever the baby is going to be. That's what happens. And then the adrenal glands they don't go away. But that component of the adrenal glands goes down, and you don't have that until they hit puberty. Then the DHEA start kicks again. So people who don't know that, I hope you guys learned something from today.
I got a baby here. So this is a baby making DHEA making baby.
Hey Angie, are you sure that?
Say hi, baby.
Are you sure that child is Danny's? He's
perfect.
too cute to be Danny's. Although he looks like Danny, I hate to admit it.
No, he looks more like his mom.
No, hell, look at the eyes, dude. Look at the eyes. That doesn't look anything like Angie, sorry.
No, you see baby pictures of Angie, it does. We're talking about how babies make a ton of DHEA up to about 6 months.
Oh yeah, you were saying that.
Yeah, we're still live.
Yeah, so it's pretty cool.
Okay, hi YouTube.
So I hope that the listeners had to enjoy and learn something from today. And I'm sorry I was late. Again, I have to move my daughter, but do they have any questions now, Danny? Are they sending any questions to you right now?
Okay, so to be clear, if I'll give you an example, my wife, she takes DHEA and she's like, Danny, this stuff makes me feel good. Like I feel good.
Yes, absolutely.
Can she safely take that without issue?
Yes, absolutely.
Okay, so there's no real age thing. If you feel like you're benefiting from it, you've tried it out, there's really no reason to not take it.
No,
if you're a woman.
I mean, even if you look at cancer, there's no DHEA elevation. There's no paper that can say there's a negative result on research on the DHEA, except again, in a woman, maybe you have increased acne if you have, a lot of DHEA. But I want you to think about this. The big experiment we have done with women, Danny, I want you to think about this little detail. Why do you give your wife so she doesn't get pregnant?
What do I give her to not get pregnant?
So she doesn't get pregnant. Birth control pills. Birth control pills are a freaking experiment. They're fake hormones at minimal dosages that are so powerful that they stop their cycle. Which is more dangerous, DHEA or those hormones? I want you to listen. Tell me, Danny. Think about it. And
Obvious.
And the birth control pills. Oh, you're 12, you need birth control pills. Oh, you're 14, you need birth control pills, right? Here I am. I did OB for 9 years, and I did OB like candy, birth control. And then I thinking, oh my God, what I'm doing to these girls? I'm changing all these things. And it's kind of funny. We give women birth control pills so they cannot get pregnant, but the birth control pills kill their sex drive. Look how stupid we are, And
I had a family member here today. I won't say who, but she's taking birth control pills. And I said, why the hell are you taking it? And she goes, oh, it's to balance my hormones. And I was like,
that is the biggest.
She goes, yeah,
yes,
I know. But she had PCOS, her testosterone levels were high, she was getting acne, blah, blah, blah. No, we're going to give you the pill. This way you're going to get pregnant and it's going to balance your hormones. But that's what the general public are taught. They don't know any better.
That's right. You change the tires so the car runs smooth enough. Yeah, but when he hits a bump, it's going to be the same shit. It's going to fall apart. That's what I don't understand. And I hope that, again, the listeners learn from what I'm telling you. I always want to give you practical knowledge. So, again, I hope they learn.
I got a couple of fast questions. By the way, when you were mentioning pregnenolone at the beginning, and you're saying, I haven't seen it get the effects in my practice that I was expecting, no offense to Dave Lee. By the way, Dave Lee, I've had conversations with him about my experience with pregnenolone. I've brought it up many times in these videos that when I take it, my libido just goes away. Erections goes like everything just literally within 3 days. And his hypothesis, I don't know if it's true or not, but his hypothesis was that perhaps I was converting it into progesterone and that my progesterone levels were actually going up, and that's what was causing these issues. And he says, I've seen tons and tons of guys that tried pregnenolone and they get exactly the same result that you're getting. He says, I've seen actually very few that are benefiting. You're saying actually the same thing as him.
I don't know the answer. I don't know what you do with the pregnenolone. Pregnenolone also is called a neurosteroid, so it affects you in your brain. It's a mental, because actually pregnenolone does relax you. And as a man is a hunter, a go-getter. We want to go check the chick out. We want to go see her. And pregnenolone calms you down, which it does. But again, I don't use it enough. I'm not an expert. So I can tell you that what I've seen is not great. And again, pregnenolone has two routes, either progesterone or DHEA. So why not give you the direct route? It's shorter. I don't use it. I see people that use it. Usually I said, it's up to you. Do you feel a difference? Most of the people say no. Oh, one of the excuses why you're not using dosages high enough. I think from 40, I think to 400. Okay, so I've seen the extreme on both sides. I don't see the results, but I don't have the experience to say that the doesn't or doesn't work, but I haven't seen it work like it's supposed to.
So if you were going to get somebody on TRT, would you by default start giving them DHEA and pregnenolone right away?
No, I would not do that. I will not do that at all. I need to find out where is that DHEA, that pregnenolone going. They're going to testosterone, they're going to estrogen. Where is it going? I don't know. No, I will not do that. I never, also, there's an old book written in 1932. I got to show you a copy of it, Danny, that looks at, my wife is telling me to get off of the thing. There's a book.
You got to go, Eric?
No, wait.
Okay.
I am the man. I am the boss.
No, you're not.
She left the room.
Bullshit. Bullshit. I'm going to call her later.
When she opened the door, I had to unpack. It's funny. What are we talking about, Danny? I forgot.
How your wife is the boss. Let's explore this a little bit. I think you've got
this is
unresolved issues, Eric.
You know, I always tell my wife, I'm the head of the house. And she goes, go ahead, baby. You're the head. I am the neck. I tell you where you're going. So, yeah, you're right. But no.
Now, we were talking about adding DHEA and pregnenolone to TRT right away, and you wouldn't do it.
I don't have pregnenolone because I don't know where is it going to go to. I mean, does the person needs more DHEA? Does the person needs more progesterone? No. And again, the only time that I use pregnenolone is on traumatic brain injuries because there's some research showing that it helps. But I don't use it for that. Actually, you said you interviewed Dr. Gordon, right? Dr.
Yes.
Mark Gordon. And
yes.
Does he uses pregnenolone or not? He uses pregnenolone, right?
For traumatic brain injuries, yes. But
yes.
Again, like we talked about this on the phone earlier, if you have a traumatic brain injury, your priority is, I don't want my head to hurt so much. I don't care if I can't get it up. I don't care if I don't have libido. I don't care. I just want my head not. Yes, we'll give him pregnenolone.
Yes.
But at the expense of all these other things.
Yes, and that's what I would do, absolutely. But I don't use it I don't have a specific clinical relevance for me to use it any other way. You know, and so far, I have great results, you know, what I'm doing. So that's my talk on that. Now, DHEA, absolutely, I use it for women that less than 40 years old, absolutely. Depends on the situation. Angie is your best sample right there. So no, in medicine, we cannot use a cookbook because we're so biochemically individual that we cannot give or do the same with every single person. Period.
What are your thoughts very fast? I'm curious, progesterone in men. You look at the range goes from 0 up to whatever it is, 7 or 8. Does that mean that there's men walking around at 0 and healthy? Is progesterone irrelevant for men, not needed? Or do men need progesterone?
I just told you that the progesterone is made by the adrenal glands. So absolutely it's important. Now, Neil and I, we have arguments or discussions, right? Neil doesn't believe that men should be on progesterone. Actually, that is wrong. That's wrong worthy. Neil has not seen research on progesterone in men that shows clinical beneficial outcomes. That's the rule. And I agree with Neil. There is no research out there saying that if I give progesterone to men, you see better results or whatever. My instances are 1, traumatic brain injury. And I know Neil might have changed his mind, maybe not. I have seen progesterone do wonders for people with traumatic brain injury. Specifically, when you have a traumatic brain injury, you can sleep. You give them progesterone, the difference, I don't care about research paper, I see it. Oh, my son is sleeping now. He had an accident on a skateboard, my son sleeps all night. He didn't used to sleep. I got to use it. You see what I'm saying? So I use it for that. I have used it for anxiety, believe it or not. Oh, man, I don't like to write benzodiazepines. I don't write pain pills in my office. I don't write any of those, but I see people that are so anxious. Of course, I look at zinc and copper. I look at all the other things, and I might check a progesterone on that guy. If it's really low, I say, let me try a small dose of progesterone and see where you are. Always oral. Always oral. The only time I use transdermal or to the skin is on women on their cycle, on the last part of their cycle. That's the only time, but I always use oral. And Neil was very good about teaching me this, actually, because we have talks about this. Always use oral, Eric, to protect yourself against lawsuits, to protect yourself against everything, so they cannot give you help. So I will always use oral in women. Do I use oral and transdermal in some women? Yes. In men, I use it for traumatic brain injury. I use it for anxiety. And usually anxiety comes with stress, but also the DHEA is kind of messed up. So, you know, which one is helping, I do not know. But I know I take them off the progesterone and they tell me I can't sleep. I need progesterone. So I do that too. And I'm going to send you a paper so you look at you're going to look a little bit different when I send you this paper. Hopefully, you can explain the paper later to the readers or to the listeners.
When you're giving the progesterone like that for all these issues, do they come back and say, I'm sleeping better, I have less anxiety, I'm more calm,
Absolutely.
everything's better,
Absolutely.
but my libido and everything has taken a hit?
You know what? No, because I'm using smaller dose. I might use 50, I might use 100, depending what I'm looking for that on that patient. But the problem is this, Danny, that is a great question. Now that I think about it, because they're so stressed by the time they come and see me, where is the stress? What's the sex factor there? They don't care about sex because they're so stressed, right? So now I give them that and they respond to stress, so they feel better. So they say, hey, I'm having sex. But he said, because, you know, they're less stressed, they're able to handle the stress. I don't know, but no, because I am very picky of who I give the progesterone to. So I never pick a Danny and say, Danny, I'm going to put you on progesterone. You know, I have to have a reason or a level or something for me to do that. Or, you know, another person that has adenoma, they take the adrenal glands out, right? Then I might put that person on progesterone, but that's a clinical, I have to do it, you know. And even though we don't do that on those men, we given the steroids, we given the testosterone, we given the clinical, you know, the ending hormones. I use progesterone sometimes on those people so they can sleep better.
Okay. The DHEA sublingual we're talking about earlier, that you said it's got more of a fast absorbing, fast acting effect.
Yes.
Would that be something that you would recommend taking twice a day, just because it's a fast acting and you have that spike and it drops? Or
when I use it, no, because DHEA gets sulfated, even though sublingual will still get sulfated, so it will last longer in your body. I see because it's free DHEA, you know, it's not DHEA sulfate, and there's two DHEA that, and Dave was very good at explaining those. I would say, I think it gets in the body and gets used immediately because it's not sulfated, and that's why it gets the result that it does. I don't have the answer because there's no research. There's no research on it, so I don't want to tell you. Someday we need to have a YouTube or no research and say whatever the hell I want, and things that I made up, you know, Danny, and then we go from there. So it depends.
Okay, I'm just reading through the chat really fast because Stephen wasn't able to make it, but very quick. One guy is asking, what does the doc recommend for sleep maintenance? Like, for example, waking up too early, unable to sleep through the night. Do any of these things have an effect on sleep?
Yes, absolutely. Actually, even if you're taking, of course, he didn't give any history, but even testosterone sometimes people cannot sleep, okay, because you get testosterone. But also, your thyroid, okay? Some people actually sleep better when you give the thyroid at night. Okay, he said he can't sleep. Why can't you sleep? This is what happens. Why can't you sleep? Do you have a traumatic brain injury? Are you having a stress? Are you a night shifter? You know, are you eating poorly? Are you working out before you go to sleep? Are you watching TV? Are you on a computer? All these things, you know, have to come into consideration. Mm-hmm. If your wife just had a baby and she's freaking getting up to go breastfeed, you know what I'm saying? And I know Danny knows about that. So no, I cannot answer that question. Now, can the hormones help you sleep? Absolutely. Progesterone is a magnificent drug to help you sleep. But why aren't you sleeping? That's my question to that guy.
Yeah.
I don't know if he can answer that, but you know.
Yeah, I'll see if he wrote it really quick or not. But, trouble falling asleep first few weeks TRT. Oh, there was someone else now talking about sleep. Is anyone else having trouble falling asleep first few weeks of TRT? Guys, I can just tell you very fast by personal experience that when my levels are higher than a given amount, I feel great in the day, but then my sleep sucks. And if I bring my levels down, I don't feel quite as good in the day, but I sleep a lot better. So it's a matter of playing with it and just finding that middle ground that works. Taking DHEA at night for me has been great. That's helped with my sleep.
Yes.
Pregnenolone has had no effect. Okay. Anything else you want to say? Dottore Serrano.
Well, the boss is calling me, so I got to go.
Okay. You got to go?
Yes, sir.
Okay.
Say hi to everybody. Say hi to Steven. I apologize to him for me.
Okay. Eric, is always a pleasure. Guys, again, subscribe to this channel. Help us out. Click the subscribe. Click the notification bell so you get the good videos. We're going to be having people almost as good as Dr. Serrano. Not quite, because he's up there. Almost as good as Dr. Serrano. Lots of guests coming up. So enjoy the rest of your weekend. Go see your wife. Don't get into trouble.
Thank you. Bye-bye, boy.
Have a good one, man. I just sent a note to Steve. Okay.